Okay, right, thank you very much. It's a pleasure to be here. Um, I did actually prefer, I thought Wormwood Scrubs would be a better place to go. It's a bit more grandiose. Having done Buckingham Palace, I thought Wormwood Scrubs would be a good foil for that. Anyway, so I'm going to talk about multiple sclerosis and sleep. A different perspective is I know nothing about multiple sclerosis, so that's going to already disappoint you. But I do know an awful lot about sleep. So my name's Stanley. As you can see, I'm a PhD. So I'm not a medic, I'm a proper doctor. I've been involved in sleep research for the last 37 years. Initially started work at the Institute of Aviation Medicine in Farnborough, working alongside the Royal Air Force, looking at things like aircrew workload, jet lag, shift work, medicines you can take and then safely fly, medicines you can take, get a good night's sleep and safely fly the next day. I was actually the first person ever to record sleep in the cockpit of an aircraft in flight. And yes, if you do a long flight, your pilot and co-pilot are asleep for most of the time. Because let's be honest, it's 7 minutes of excitement at the start, 7 minutes of excitement at the end. And the rest of the time, you're just looking out of a sunny window. In the early 90s, I moved to the University of Surrey, where I created and ran the world's largest clinical trial sleep laboratory. So a 24-bed unit. And as part of that, I designed and constructed the 12 finest bedrooms built anywhere on the planet for a good night's sleep. Totally dark, totally quiet, temperature controlled, single bed, teddy bear. That's all you need for a good night's sleep. I've been involved in about 250 clinical trials, so pretty much any drug that's had any effect on sleep in the last 30 years, I've had a small, or in some cases a very large hand in the development of those drugs. About 13 years or so ago, I made the biggest mistake of my life. I got a job as a manager in the NHS, not realising that in order to be a manager in the NHS, you have to be a complete muppet. So me and the NHS had a very big falling out. I have worked clinically on Harley Street, Copenhagen, and most recently with my friends out in the Louisenberg Hospital. I'm a member of all the things you should be a member of as a sleep expert, and I've published 38 scientific publications. Now, the reason for showing you this is not to be boastful. Yeah, I'm not trying to tell you I'm brilliant. That's going to be self-evident from the talk, to be honest. It is the fact that I am a proper sleep expert. There are many people out there giving us sleep advice that have no qualification in sleep at all. They have no training, they have no qualifications. They're in the media, they're giving nonsensical advice, but I am a proper sleep expert. For the last 12 years, I've been a freelance sleep expert. I travel the world talking about the importance of sleep, basically to anybody who'll listen. So on Monday, I was meeting a theatre company in London about a play they're going to be putting on next year about insomnia. Tuesday, I was filming for Marriott, something for their travellers, the video for them. Wednesday, I was talking to retirees from Martin Baker ejection seats. Yesterday, I was down in Bristol talking to the community neurophysiology team, OTs and that. And today I'm here. So this is what I do. And many of the lectures that I do are free, like today. I don't charge a fee. I don't charge my expenses. So if you've got a group who want to have a lecture, then I'm free. So just call me, sort of. I think somebody is. So anyway, so I travel the world talking about sleep. So why do I do that? Because sleep disorders in individuals remain underreported, underdiagnosed, and treated. The problem with the way we do medicine in the West is that we love to label people and we love to categorize people. So you're an MS patient, so you get your MS seen to, and that's great, if only it was the only thing wrong with you. I do a lot of talk for people like breast cancer care, and I talked to somebody with secondary breast cancer. She said in the 11 years she's seen her oncologist, never asked her about sleep once. And so I'll ask you, have you ever been asked about your sleep? Maybe. Have they done anything about it? No. It's probably the right answer, because people don't. It's underreported. In a GP scenario, 55 to 65% of people have a problem sleeping. In a hospital scenario, it's 100%. Have you ever slept in a hospital? Most miserable places on earth to try and get a good night's sleep. Absolutely against every single thing that Florence Nightingale said about how you should design a hospital is now done in modern hospitals. Modern hospitals are designed to kill you. Simple as that. God knows why. Have you ever slept on a hospital bed? Awful. Awful places. Anyway, so they're underreported. They're underdiagnosed. There are 96 recognised sleep disorders in the International Classification of Sleep Disorders, 3rd edition. We could have a game and name the top 10 sleep disorders. You'd get 3 and I'd have to help you. You all know about sleep apnea. You all think it's fat middle-aged men. The worst case I ever saw was thin, 16 and female. So never rule out the possibility of sleep apnea if you've got daytime sleepiness. You all know about narcolepsy. You've never met a narcoleptic patient, but it is funny watching them fall over on YouTube. And then everybody else has got insomnia, whatever that means. And then they're undertreated. Within the NHS, there are 2 evil things: cigarettes and sleeping tablets. You might understand why cigarettes are not thought of as very good, but sleeping tablets, tablets that help you sleep. I did an MS Trust conference last year, and I had a nurse write to me. She said she's got a late-stage MS patient who's allowed sleeping tablets 1 week a month, because the sleeping tablet's what's going to kill him, isn't it? Yeah, that's why you have... He sleeps perfectly well when he's allowed the drugs, but his doctor thinks, oh no, they're addicted. Do you think the patient cares they're addictive? Which they're not anyway. That's not medicine, that's dogma. That's a ridiculous thing to do to a patient. But there we are, that's what the NHS have been told. Don't put people on sleeping tablets, or if they're on sleeping tablets, take them off. And give them stupid drugs like trazodone or mirtazapine or paroxetine or God alone knows what, none of which have got the slightest shred of data showing that they're beneficial for sleep. But we can't give them sleeping tablets. Why not? Don't worry, it gets worse. Make things... So, why do we sleep? Well, we're not absolutely greatly sure as why we sleep. It's important. You have to do it. You all did it last night. You're all going to do it tonight. You may not have done it that well, but you did it anyway. We know it's needed for recuperation and restoration of both physical and mental functioning, but it's not really physical recuperation because you're recuperating as I speak. You're sitting down, your blood pressure's dropped, your heart rate's dropped, you're not using your major muscle groups. So your body is repairing and recuperating now. You may do more of that at night, but you don't need sleep in order to do that. The mental functioning is a bit different. You do need sleep for that. Sleep's important to the optimal functioning of the endocrine, metabolic and the immune system. So if you get a bad sleep tonight, tomorrow you're 3 times more likely to catch the common cold, let alone anything else. It's as simple as that. Sleep affects all organs of the body, but primarily sleep is of the brain and for the brain. The only bit of the body that must have sleep is the brain, because only during the night can the brain do its housekeeping and the brain's activity reduce and it repair and recuperate. Oh, I keep forgetting I haven't plugged that in. So in any one 24-hour period, you're in one of 3 distinct states of being. You're either awake, which all thankfully you are now, or you're in non-rapid eye movement sleep, or you're in rapid eye movement sleep. Now, REM and non-REM are as different from each other as they are from awake. You don't realise that because you're asleep, but they are very different. Non-REM sleep makes up 75 to 80% of the night, traditionally made up of 3 stages of sleep, each of increasing depth. So stage 1 is the transition from awake to asleep. If you are awake and you go to sleep, you'll go through stage 1 sleep whenever you fall asleep. Stage 1 sleep is, of course, the lightest stage of sleep, such that if I were to wake you up during stage 1 sleep, you would say, why did you do that? I wasn't actually asleep. And stage 1 sleep is that sleep you get when you're driving, you know, when you're driving along and... Or you think, where did the last 5 miles go? Or it's the sleep that your partner has when they say, I had a terrible night's sleep. I didn't sleep a wink, and you say, well, that's funny because you were snoring all the way through it. Stage 2 sleep, 50% of the night. You'd have thought the thing we do 50% of the night would be really, really important. It probably is, we just have no idea why. Stage 3, deep slow wave sleep, 25% of the night. Slow wave sleep's the bit of sleep that is the most important part of sleep. It's the bit of sleep that makes you think you've had a good night's sleep. It's the restful, recuperative part of sleep. And slow wave sleep is vital for 4 reasons: memory, forgetting, learning, and growth. So everything about today that you experience, you will keep in your memory until tonight. Tonight, your memory will sort out every single piece of information you've received. Now, some of the information you've received today is nonsense and you can throw it away. You can get rid of it. Some of the information you received today is important. And so your memory lays that down as a permanent memory. And not only does that, it files it away so you know where you've put it. Because if you're trying to pass an exam, there's no point staying awake cramming. Because if you do that, you gain the information, but you don't lay it down as a memory and you don't file it away. So when you come to the exam the next day, you know what it's like? It's on the tip of your tongue. You know you've got it. You just don't know where you've put it. So if you want to pass an exam, read what you need to remember 3 times before you go to bed. The brain will know it's important, lay it down as a memory, and you'll be able to retrieve it the next day. It's not a guarantee you'll pass the exam. You may just be stupid. But nothing I can do about that. You learn during slow wave sleep. So if you practice a task until you're as good at that task as you can be, that be a mechanical task or a verbal task, get a good night's sleep, you'll be up to 17% better at that task merely because you have slept. And slow wave sleep is the only time you physically grow during the entire 24-hour period, or indeed in life. So I, of course, had loads of it when I was a child. Rapid eye movement sleep is the second state of being, 20-25% of the night. Rapid eye movement sleep is when you have your long narrative dreams. Everybody dreams 4 or 5 times a night, but you can only remember a dream if you wake up during them. If you don't wake up, your dream is gone and it's gone forever. Now, your dreams are involved in emotional well-being and emotional memory. So deep sleep is about factual memories. What happened? REM sleep is, how do I feel about what happened? Now, when you are dreaming, your dreams are real. They're as real to your mind and body as sitting here now is real. So if something occurs in the dream, you can have a physiological response. And you've all woken up with your heart pounding, breathing heavy, sweating, feeling fear or anxiety, because that's exactly what has happened in your dream. And you know sometimes that you wake up in the morning, think, I can't possibly go to work today. I've just spent all night fighting dinosaurs and frankly, I'm exhausted. Well, that's because your body genuinely believes that's what's happened. Now, it'd be a bit embarrassing if 4 or 5 times a night you'd have run around the bedroom being chased by dinosaurs. So nature protects you and your bed partner from harm. When you dream, you lose muscle tone, so you are unable to act out your dream. Essentially, you become floppy. Except, interestingly, one bit of the male that does the exact opposite. However, that has nothing at all to do with the content of the dream. So how is sleep put together? Well, you'll see this. This is a typical night. This is absolutely nonsense, but it's what we show because this is the sort of thing, if you've got a Fitbit or a sleep tracker on, we'll show you this sort of nonsense. It's absolutely meaningless, but it just shows you basically what happens during the night. As a healthy, normal adult, you should fall asleep within 20 minutes. A normal, healthy adult will fall asleep within 20 minutes. Regularly taking more than 30 minutes to fall asleep is indicative of insomnia. But also falling asleep too quickly isn't a good thing. If you're one of these people who head hits the pillow and you instantly fall asleep, basically you're sleep deprived. It's as simple as that. It should take you a finite time, 7 to 12 minutes to fall asleep. You'll quickly go into your 20 minutes later, you'll be in your first period of deep sleep, so you'll have a consolidated period of deep sleep. After around 70 to 120 minutes, you'll have your first dream period. That may only last 5 minutes long or so. Then a bit more deep sleep, and then on a roughly 90-minute cycle, you have your REM period. So most of the deep restorative sleep in an adult is in the first third of the night. The latter part of the night is in that lighter stage 2 sleep or REM. Now, you are preferentially designed to wake up during REM. So if you woke up last night, which you did because you're here, but if you woke up in the middle of the night to go for a pee, it was around 3 to 3.5 hours or around 5 hours into the night. If you don't believe me, check tonight, see what a genius I happen to be. And if you woke up this morning, which again you all did, without an alarm clock, you will have woken up in that last dream. Did you know, this is an aside, that if you wake up in the morning, statistically, you're not going to die of natural causes that day? If you're going to die of natural causes, you'll do it before dawn. Yeah? So have a smile. You're going to get through the day, probably, unless you get run over by a bus. But, it's, so every day, start with a smile. I made it for another day. It's pretty good, isn't it? Anyway, so the fact that you woke up this morning without an alarm means, of course, you'll, to some degree, remember that dream. The fact that you remember that dream doesn't mean it's the dream you tell your partner about. Because let's be honest, the dream your dreams are very, very dull indeed, and your partner's already started to suspect that you're quite boring during the day. So why during the night, during your fantasy life, can't you be a bit more exciting? And if your dream was remotely exciting, you still wouldn't tell your partner about it because they were not in it. So how does sleep change with age? Well, children need a lot of sleep. Why? Because they need a lot of deep sleep. Why? Memory, learning, growth. Every important thing about the development of a child occurs during the night. You mess up the night, you mess up the child. Just 40 minutes less sleep for a child has a measurable effect on its academic performance and its behaviour. A newborn needs 16 to 20 hours. A 10-year-old needs approximately 10 hours sleep. Once you go through your preteen into your teenagers, teenagers are different and teenagers are odd. Teenagers are different because they genuinely need more sleep than adults. Why? Because they're going through puberty, physical and emotional changes that they need to go through. They need to go through them during the night. Teenagers are odd because teenagers genuinely need to go to bed later. We don't know why, but there's a shift in their biological clock. However, that shift is only at most 2 hours. So your average teenager should be going to bed at 11:30 or 11:30 and sleeping between 9 and 9.5 hours. Which means if a teenager says they cannot get out of bed at 9 o'clock in the morning, they might be telling you the truth. Teenager who says they cannot get out of bed until 3 o'clock in the afternoon, however, is merely lazy. Once you go through your teenage years into your early adulthood, your sleep need becomes fixed for life. Old people do not need less sleep. An 85-year-old needs the same amount of sleep she needed when she was 25. The problem is, it becomes much harder to get that sleep because what happens as we get older is we progressively lose that deep, slow wave sleep. So sleep becomes less refreshing. So you can sleep through the night and wake up and think, what was the point of that? It's like going out for a night out and just drinking shandy. You've done it, but it wasn't that much fun. The other thing about this slow wave sleep, think back to children. Children have loads of slow wave sleep. Children sleep anywhere through anything. And if they wake up, they can fall straight back to sleep. There's a lot of pressure for them to sleep. It's the most important thing they can do. But if you don't have that slow wave sleep, you're going to be more easily woken up. And once you are awake, there's no pressure for you to go back to sleep. So when you were 20, you woke up, you had a pee, you got back into bed, fell asleep immediately. And if somebody said, how did you sleep the next day? You'd say, I slept fine. Now you wake up, you have a pee, you get back into bed, you lie there for the next hour and a half thinking, this is nice. So that's what happens. Sleep becomes more fragmented and then there's no pressure to put you back to sleep. So if possible, treat the thing that the patient is waking up. If you can't do that, then treat the thing that is keeping them awake. Depression, anxiety, pain, whatever it may be. Now, I tell you your sleep... Oh, sorry, I didn't... go back one. There's a sex difference in this loss of slow wave sleep. Men start losing their slow wave sleep a lot earlier than women. Men start losing it from around the age of 35 or so. Women from around the age of 55 or so. The consequences of this is why your man's memory is going. He's not selectively deaf or stupid, he's just old. He doesn't have the slow wave sleep to lay the memories down. This is why men statistically die younger than women. It's not like the old Simon Munnery joke, why do men die before their wives? Because they want to. And this is why men have worse sleep as we get older. Over the age of 60, men have worse sleep compared to age-matched women. Women complain more, just in general about everything to be honest, but they complain more about poor sleep, but it is actually men over the age of 60 who have the worst sleep. So I tell you your sleep need is fixed for life. How much sleep do you need? Well, sleep need is like height. It's genetically determined, and we're all individuals. So just as you have short people and tall people, you have short sleepers, Genghis Khan, Adolf Hitler, Napoleon Bonaparte, Margaret Thatcher, and you have long sleepers, me and Einstein. Anywhere between about 4 and 11 hours can be considered normal. The important thing is to get the right amount of sleep for you as an individual, whatever that may be. 8 hours is an average. It is not an ideal. So how much sleep do you need? The amount of sleep you need is the amount of sleep that allows you to feel awake, alert, and focused during the day. It's as simple as that. If you're awake, alert, focused during the day, you've had enough sleep. If you're tired during the day, well, that tells you nothing about sleep. Tired is what I like to call having a bit of a rubbish life. Tired has got to do with, this is a hell of a lot further from the station than I thought it was, and I've got to walk back and I've got to go home in rush hour, and I don't know what I'm doing tonight, but I haven't got a Euro Millions ticket, so I'm going to have to carry on lecturing to people like you for the rest of my life. I'm just a bit tired, it's just, it's got nothing to do with sleep. If you've got a problem with your sleep, you will be sleepy during the day. Now, you might say, what's the difference between being tired and sleepy? It's very simple. You walk up 3 flights of stairs. When you get to the top, do you need a sit down or do you need a sleep? If you need a sit down, you're tired, fatigued, knackered, exhausted. If you need a sleep, you're sleepy. Okay? People will use the word tired to mean both, but they'll never use the word sleepy to mean tired. So if a patient says to you, I'm tired, you need to find out what they mean. Have they just had a row with their missus and kicked the cat, or are they desperately wanting a good night's sleep? So in MS, what are the problems? Well, problems can be there before MS, and of course the illness can worsen. Sleep problems can be caused by MS, but they can be managed. And sleep problems may develop independent of MS, but they can often be complicated by MS. If you look at polysomnography data from sleep labs, 74% of MS patients had a sleep disorder. So it is a significant proportion of people. But I say, if you're not asked about your sleep problem, they're probably never going to find out about it. The problems that are there. Obstructive sleep apnea is probably the most prevalent. Restless leg syndrome. Now, people often get this confused. You have restless leg syndrome and you have periodic limb movement. Restless leg syndrome is the inability to sit still or lie still, and you have to get up and walk round to make the sensation go away. Somebody once described it as like ants crawling under the skin. That's restless leg syndrome. Periodic limb movement is where you kick in the night repeatedly. They're two separate things. The treatment's exactly the same, but they are two separate things. REM behavior disorder, acting out your dreams, which can turn to violence, even murder. And then narcolepsy, again, is very, very small. But there are significant things going on during MS. So you can have insomnia, which was present before MS, insomnia due to the MS. And if you improve MS symptoms at night, of course, you'll improve the insomnia. Depression and insomnia go hand in hand. 70% of people with depression have insomnia. 70% of people with insomnia have depression. They go very much hand in hand. Nocturia, getting up to pee or needing to pee during the night. Sleep apnea causes insomnia. And medications. Some antidepressants. A drug like Prozac has a side effect of insomnia in 26% of people. So if you are on polypharmacy, I would suggest the first thing you do is get a medicines review from a pharmacist. Find out what you're on, because not one single clinician will have ever considered the sleep effects of any of the medications they have ever given you. Yeah, because they're treating the primary complaint. They're not treating you as a patient. Yeah, I could cope with my pain if only I got a good night's sleep. Oh, so you're a pain patient? No, I'm not. I'm a sleep patient. Didn't you hear me say sleep? Oh, but we don't know anything about sleep. So we're going to send you to the pain team. The pain team, we're going to reduce your pain by 30%. And you're better. No, I'm not. Well, why? Are you just being awkward? Well, no, because you haven't treated what I complained of, which was I can't sleep. So anyway, find out what you're on, because they haven't bothered to think about it. Differential diagnosis. Is it sleepiness or fatigue or something else? Sleepiness is like, I've explained it, the desire to fall asleep. Fatigue is muscle weakness, lack of energy, just not feeling great. They are different. Of course, poor sleep can feed into fatigue, but they're not the same thing. So when you talk to your physician, be absolutely clear what you're talking about. Don't talk about being tired. Don't say you're fatigued if you're not fatigued. And if you want them to get to listen to you, tell them you are sleepy during the day and it is affecting your life. Don't talk about how long it took you to fall asleep or any of that. They don't care. But tell them that you're going to commit suicide because you're not going to sleep. Then they might listen to you. Or you're going to crash a car into a school bus. Then they will listen to you. You might be lying, but it's your health, not theirs. Yeah, they don't care because they're going to go home to their multi-million-pound mansion and play golf whilst you have to put up with their decisions. So be a right pain in the arse if you have to, because nobody's going to advocate for your treatment unless you do it. I think that might be the last rant. There may be more. I've forgotten what slides I've put in. We'll skip that. What have we done? Why am I going backwards? So, pain and sleep. Pain, depression, anxiety, sleep disturbance, they're all linked. They're all part of the same brain systems. If you have damage in one, you'll have collateral damage in another. It is not good enough just to treat pain. If you don't also treat sleep disturbance and the depression and anxiety, you'll never get the patient having as good a quality, optimal functioning, etc., etc. So you need to break that cycle. Benzodiazepines, I mentioned it at the top. The NHS says you can't have benzodiazepines. However ill you are, you can't have them, even though they work. Why? Because you develop tolerance with them. No, you don't. Ian Oswald, 1986, showed that with benzodiazepines, you can take them for 26 weeks, there's no tolerance. Tom Roth, 2013, showed you can take Zolpidem for 8 months. There's absolutely no tolerance to them at all. You get rebound insomnia when you stop sleeping tablets. Of course you do. You've got a sleep problem. Nobody addresses the cause of the sleep problem. And then if you stop the drug that helps you sleep, then you suddenly don't sleep again. That's rebound insomnia. Somehow that's bad. When I do this talk to pain specialists, I say, have you ever heard of rebound pain? You're in pain, you're on effective pain medication that makes the pain go away. If you stop the pain medication, you're in pain again. Oh, that's a stupid concept, they say. I said, well, why is rebound insomnia not equally stupid then? Addiction. Well, the Christer Algelander in Sweden looked at the entire Swedish medical history database and he showed that the addicts to benzodiazepines and the Z drugs works out to be 1.4% of the population. Guess what the rate of addicts in the Swedish population are? 1.4%. Addicts become addicted. If they weren't addicted to benzodiazepines, they'd be swallowing hair gel or eating Benylin or whatever. They're addicts. They do addictive things, and it shouldn't worry you because they all live in Scotland anyway. Oh, people like taking sleeping tablets. They're addicted to them. No, they like taking them because they bloody well work. That's not addiction, that's pharmacology, for crying out loud. And you've all heard that sleeping tablets cause falls in the elderly. No, they do not. This might surprise the intelligentsia amongst you. You cannot fall if you are asleep in bed. I know that might sound a complex idea to get your head round, but to me it's pretty bloody... Anyway, so hypnotic use is not independently associated with the risk of falls. Insomnia is. Because you get up and then you fall over. So all of this nonsense is down to one man. It's down to Malcolm Lader, Professor Malcolm Lader, who somehow persuaded the UK government that sleeping tablets are evil. And that is why you can't get them. Even though it helps you sleep and even though you really want to sleep, the NHS doesn't give a monkeys about you. So 4 questions to screen for sleep disorders. I promise I will be finishing soon. As I say, how do you feel during the day? If you're sleeping well during the night, you'll feel great during the day. If you feel great during the day, you don't have a sleep problem. Are you generally content with your sleep? Yes, no. If you're not content with your sleep, you've probably got insomnia. Are you excessively sleepy during the day without obvious cause? Excessively sleepy is not falling asleep on a nice Tuesday afternoon when the sun's streaming through your window, staring at your computer. Excessively sleepy is falling asleep whilst having a conversation. And then does your bed partner complain about your sleep? Do you do anything in your night which annoys your bed partner? Do you walk, talk, kick, punch, fart, snore, stop breathing? Do you do anything? And that will pick up your parasomnia. That takes 20 seconds and picks up 90% of sleep disorders. Now, I do have more slides on how to take a sleep history and things what you should look after, but we don't have time, so we won't do it. You've all heard about cognitive behavioural therapy for insomnia. You've all been told that cognitive behavioural for insomnia is difficult and you need to see a psychologist for 6 or 8 weeks and it takes a long time and you've got to wait 6 months for it. No, you don't. Cognitive behavioural therapy is not at all difficult. The reason it was made difficult is because psychologists couldn't spell psychiatry when they were applying to university and they got a chip on their shoulder. So this is cognitive behavioural therapy for insomnia. There we are. That was good. So I'm going to now do it in 5 sentences because I'm clever. And this will be my last slide. You can all relax and breathe deeply. How does sleep catch us best? This generally is CBT for insomnia in 5 sentences. Sleep promoting environment. Your bedroom needs to be your sleep room. You need to go to your bedroom to sleep. That's the only thing you do in your bedroom is sleep. If you're not asleep, you're not in the bedroom. Your bedroom needs to be a sanctuary. Your bedroom needs to be dark. How dark's dark? The red standby light in your TV is enough light to disturb your sleep. So when I say dark, I mean pitch black. Blackout curtains, blackout blinds, eye mask, gaffer tape over red lights, then your extension lead, whatever you need to do, your bedroom needs to be dark. It needs to be a moderate temperature, 16 to 18 degrees. In order to get a good night's sleep, you need to lose 1 degree of body temperature. You lose that body temperature out of your head and face because it's the bit that sticks out from under your duvet. So your bedroom needs to be cool. The bed can be warm, but you heat the bed up just by being in the bed. So the bedroom needs to be cool. So you have that temperature gradient. Quiet, 35 decibels, intermittent peaks of 45 decibels. 35 dB is around about the background noise in this room without me talking. So if your bedroom is noisier than that, it's going to disturb your sleep. If you have a snorer in your bed, 75 to 95 decibels. So if you've got a snorer in your bed, get rid of them. I don't mean kill them, I just mean send them somewhere else. If you're in a hospital, at shift change, 113 decibels. You might as well stick your patients at the end of Heathrow runway, because at least it's only 105 there. Well ventilated, fresh air is good for sleep. Comfortable. 7% of people in the UK have spent less than £100 on their bed. What do they expect? I think if you spent less than 100 quid on your bed, you deserve every bad thing that's ever happened to you, and you shouldn't be complaining to your doctor. Can you help me sleep? Not unless you help yourself. Quiet mind, relaxed body. Relaxed body isn't that important. You all know you can be absolutely physically exhausted, but you can't fall asleep. Why? Because you don't have a quiet mind. So how do you quieten your mind? Well, I don't know. I know what I do. I read every night. But that might not work for you. So if you want to do mindfulness, drink chamomile tea, do yoga, do those adult colouring in books, listen to Pink Floyd really loudly. I don't care what you do as long as you do it for some time before you go to bed to quieten the mind. Have a wind down. Relax. It's not difficult. I'm not asking you to eat vegetables or to go jogging. Have you ever seen a jogger smile? No. Anyway, so quiet mind, that's the key. That's the prerequisite for sleep. Strong association for sleep and bed. If you're asleep, you should be in bed. If you're not asleep, you shouldn't be in bed. If you haven't fallen asleep within the first 30 minutes of the night, get up, do something else, go back to bed when you're sleepy. If you've been awake for 20 minutes in the night and you still can't fall back to sleep, get up, do something else, go back to bed when you're sleepy. If you still haven't fallen asleep after another 20 minutes, get up, do something else, go back to bed when you're sleepy. There's no point lying in bed. You start hating your duvet, hating your pillow, hating your mattress, hating the bastard next to you because he's snoring away, showing you no sympathy. So get up, do something else. Does it matter what you do? No, read a book, have a cup of tea, listen to some music. For women, I recommend you do the ironing. Because what better motivated to go back to sleep than a big pile of ironing? And if you don't fall asleep, at least you've done the ironing. That's a joke, and it got me banned from John Lewis Partnership and Historic Royal Palaces. But it's my joke, and I'm sticking with it. No direct effort towards sleep. I must get sleep, I must get sleep, I must get sleep, must get sleep, must get sleep. Not going to happen, is it? Yeah? You just need to put your mind and body in the place for sleep, and then you will fall asleep. It's like the Nike advert, just do it. Absence of regular thought process is about sleep. Any of you read Matt Walker's sleep book, Why We Sleep? Yeah? All Matt's done is try to scare the bejesus out of you. If you don't sleep, you're going to die. It's caused insomnia in more people than anything. Oh, God, I'm going to die if I don't get enough sleep. You know, it's like, I've got a big day tomorrow. I need a good night's sleep tonight. Because if I don't have a good night's sleep, I'll go to work tomorrow and I'll make mistakes and the boss will sack me and then I won't be able to pay the mortgage and the wife will divorce me, I'll lose my house and I'll die in a cardboard box under the M1. Can't sleep now, can I? So don't think about it, just do it, as the Nike advert would say. So that literally is cognitive behavioural therapy. That's all it is. You can do that. It's not difficult, it's not hard. Now, if you do want to do cognitive behavioural therapy for insomnia, and I need to keep pressing that bloody button, some of you may have heard of Sleepio, online cognitive behavioural therapy for insomnia. And Sleepio is available on the NHS in London and Oxfordshire. And they're such a lovely company. They're a £20 million venture capitalist company, and the NHS has to pay them to give out free treatment. £20 million venture capitalist funded company, and the NHS is paying them. It may surprise you that sleepful.me was paid for by NHS research funding. So, and it's completely free to everybody on the planet. Why the hell the NHS are paying a venture capitalist company when they paid to develop something which is exactly the same for free? Hands up who can tell me why that would happen. Did say earlier, NHS managers, Muppets. Sleepstation.org.uk is available on prescription in England. On the NHS, it is available on prescription. So if you want to investigate CBT, both of those are available to you, and they are completely free both to you and to the NHS. Okay? And people say, well, why aren't they different? Well, yes, you've got a basic recipe for a sponge cake. You go to your local WRVS in the hospital, you get a piece of sponge cake for a couple of quid. You go to Patisserie Valerie in London, you pay 8 quid for the same thing. Yeah? It's still a sponge cake, so don't worry about it. So there we are. So, majority of MS have sleep disorders. Majority of them are easily treated. As I say, there's some things that are about your condition. There are some things about you getting older that you can't do about. But there's plenty you can do about sleep disorders. If only you can get your physician to take it. Seriously, depression, pain, sleep apnea, leg and bladder spasticity, restless legs, anxiety, poor sleep hygiene, drug side effects. As I say, all of those are pretty fixable. Fatigue and daytime sleepiness are not the same. And that's it. So that's me saying thank you. That's who I am. That's my email address for hate mail. That's my website address for random lunacy. That's my book. That's proof my book works. Thanks very much. Any questions? That was an hour and a half talk in about 40 minutes, so that was pretty rubbish. Madam at the back.
Thank you. Is the switch on?
Yeah.
Okay. Yeah. You see, you didn't actually say anything about caffeine except a very passing mention of stimulants.
Okay, caffeine.
What were you going to say about caffeine?
Yeah, we're all different. Some people are very sensitive to caffeine. Some people are insensitive to caffeine. So some people can have 2 strong black coffees at night, sleep perfectly well. Other people have 1 coffee at lunchtime and get awakened by it. It's up to you. Find out. There's no magic time. All this stop it at 12, stop it at 2. Find out when you can have your last cup of coffee. But if you've had a nice 3-course meal with wine, there's absolutely no point in saying, oh, I'll have decaf. You've done the damage. You might as well have decaf there. So it's what works for you. Caffeine takes 30 minutes to work, and it will only boost your performance for 30 minutes. A nap, 20-minute nap will boost your performance for 3 to 4 hours. Yeah, my slides will be copied. Anybody who wants them can have them be sent to you, sir.
I snooze my alarm about 4 or 5 times before I finally get up.
Yeah.
I've read somewhere that that's bad for you.
Yeah, I mean, I personally believe it's bad. My version is that you should set your alarm for the last possible moment that you have to get up, and then get up there, because then you'll have consolidated sleep rather than 5-10 minute broken sleep. And every time the alarm clock goes on, it scares the bejesus out of you, and that's not a good way to start the day. So it'd be far better just to set it for that last time, and then know that that's the time you have to get up, because you'll get more consolidated sleep there than if you're not. However, if you're lying there awake, just wanting to be in bed, then fine. But if you're sleeping up during each of those alarms, then you should, as I say, have consolidated sleep. Madam?
What are your thoughts on like white light screen time?
Okay, screen time. You all know that blue is bad because blue suppresses melatonin, 460 to 480 nanometers. Exactly the colour of my slide deck. It is impossible to fall asleep during one of my talks. You just thought I made this crap up. I did think about this. Now, screen times. Blue light, of course, tells you it's daytime, hence the blue sky. So blue is good. But screens fluoresce blue, and we thought that would stop you producing melatonin, making you not fall asleep as quickly, having poor sleep and feeling sleepy the next day. However, very recent work from Finland has shown that actually we need a dose of blue light. So if we're outside on a bright summer's day, we get loads of blue light, and then the blue light from the screen will make no difference. If you sit under horrible lights like this all day, then the blue light tonight will make a difference. So there is a dose of blue light. So avoiding screens. Kindles also affect your sleep because it's bright light, not just blue light, and taking your blue out of your screen with night shift or F-lux or anything doesn't work because it makes your screen muddy and you turn the brightness up, and bright light's just as bad as blue light. So avoid screens, because also if you're looking at the screen, you're stimulating yourself. If you've just watched The Exorcist, there's no way you're going to fall asleep, whether it's blue or not. Anybody else, or shall I shut? Oh, one more. I will be around for lunch if you've got anything else. But
aromatherapy sleep oils, is that a placebo effect, a real effect, or?
Does it matter? If it works, doesn't matter. I hate the smell of lavender. Most of them are lavender based. If I was in a house with lavender, I'd have to find it and burn it before I could fall asleep. But if you like lavender, or if you find it works, fine. It's no problem. If it's placebo, don't care. If it helps you sleep, keep doing it. If it doesn't help you sleep, stop doing it. Yeah, it doesn't matter. I'll sit down. I'll get me this when we probably.